Good morning or good afternoon, wherever you're joining us from today, and welcome to the Supporting Workers with Disabilities and Building Stronger Workplaces webinar in partnership with the Institute for Work and Health and delivered through our Skills Bridge project. I'd like to start with the OCC acknowledging that the work we do takes place on the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, which is now home to many diverse First Nations, Inuit, and Métis people. Our regional hubs and partners across Canada similarly gather on the traditional territory of many Indigenous nations who have cared for these lands since time immemorial. Thank you for joining today, where we'll be touching on some very important subjects in the workplace. We'll be defining the decision-making process that workers undertake when considering whether to share personal health information with others in the workplace. We're going to describe a new resource that assists workers in deciding whether to communicate their support and accommodation needs, and identify workplace support ideas and strategies to assist workers living with chronic and episodic health conditions. As you're aware, depending on if you have this webinar on in the background, maybe you're listening on your phone or on your lunch break or doing 3 other things at once. Many small businesses across Canada lack the capacity to develop and deliver training or even release people for training. They generally suffer severe labor and skills shortages, as well as lack access to the resources of large companies to address their upskilling and human resources needs. In response to these pressing, relatively challenges that multiple people face, depending on your industry, depending on your size, we developed, in partnership with the Diversity Institute, Magnet, and funded by the Future Skills Center, a Skills Bridge project in 2021 that we've been testing and evaluating a digital platform to help bridge that gap for small businesses. We developed and evaluated a new approach to addressing small and medium-sized businesses' skills shortages through this national digital training platform, which is tailored to all of their upskilling needs. Also through the project, we're able to provide webinars on topics in the equity, diversity, and inclusion ecosystem, such as today's webinars on disabilities. In the future and in the coming months, we'll have about 5 to 7 more webinars between June and September, so be on the lookout for those in our newsletter and social media. SkillsBridge provides free access to 20 learning pathways curated from 70 courses in areas such as EDI. So for example, in EDI, it's whether it's in your leadership team or board, your hiring processes, procurement, or even employee well-being. There's also management skills, lots of digital skills courses, HR, sales and customer services, marketing, and more. As part of your participation today in the webinar, thank you again. We'd like to offer your organization free, unlimited access for up to 10 employees until the end of August 2025. The platform is set up for business leaders, so they would create, one person from each business would create an account and invite the other employees, where they would also have access to an admin dashboard where they could assign courses and track progress. All that's asked in return is completion of some voluntary surveys to gauge feedback on the platform, courses, and how your organization operates. For the webinar today, we'll be putting in a link to a survey, if you'd be so kind to let us know how it went at the end. And in the coming days, we'll be sending you a recording with some extra resources and the slide deck that our wonderful presenter will be sharing. Our partner for this webinar is the Institute for Work and Health, who are an independent, not-for-profit research organization based out of Toronto, Canada. Established in 1990, the IWH focuses on conducting and mobilizing research to protect and improve the health, safety, and well-being of working people. Their mission is to support policymakers, employers, and workers in creating healthy, safe, and inclusive workplaces. Some of the research areas are that they examine the interrelationships between work and health from worker, workplace, and system perspectives, and their core funding comes from the province of Ontario, ensuring the independence and impartiality of their research. They're also governed by a board of directors and guided by a scientific advisory committee. With that, I'd like to introduce our speaker for today, Dr. Monique Gignac, who is the scientific director and a senior scientist at the Institute for Work and Health, and also a professor at the University of Toronto. Her research examines the psychological factors like stress, coping, and adaptation, and their importance of understanding the impact of chronic health conditions of the lives of working adults. Of particular interest is the research on workplace support, accommodation, and communication among individuals living with chronic disabling conditions. So thank you again for your time today. And with that, I'll give it over to you, Dr. Gignac.
Okay, thank you. And thank you everyone for joining. Okay, hope you can see all of that. As Hunter mentioned today, I'd like to talk about supporting workers with disabilities and building stronger workplaces. What I'll do is I will set the stage a little bit. I'll talk about disability in Canada and some numbers around disability, what we mean by episodic disability, disclosure of a disability, why these decisions are so difficult, tell you a little bit about some tools that we've developed around decision making, supporting people making decisions, and tools to help with accommodation planning. In terms of my takeaway messages, I'm going to give you them also right up front. And they are essentially that many workers don't share health or support needs at work. These decisions, whether to share some information or needs, can be very complex and stressful for workers. We also know that workers and organizational representatives, people such as yourselves, many of you, as well as healthcare professionals, are often unclear about what to focus on in having workplace discussions and what types of supports and accommodations might be helpful. So we've created some tools at the Institute for Work and Health, along with a lot of other partners, I'll mention them in a moment, to help workers consider whether to share personal information and what to share, as well as a job demands and accommodation planning tool that helps identify diverse areas where a person may be finding work challenging, as well as they'll give them some practical support and accommodation ideas. And there are worker and organizational versions of the JDAPT that I'll cover as well. In terms of who we are, again, I'm presenting today, but in fact, there's a very large group of people who are behind this research. We called ourselves ACE, Accommodating and Communicating About Episodic Disabilities. And this was a big partnership to try to support the sustained employment of people who live with more intermittent chronic health conditions. I'll come back to that. But what I'll mention here is the team has a lot of different expertise. We have occupational therapists, occupational physicians, clinical psychologists, physical therapists, ergonomists, social psychologists, epidemiologists, a whole really wide range of people with different backgrounds. We've also had an expert advisory committee, and these are individuals with lived experience of very different types of health conditions and disabilities and working at very different types of jobs. And they provided guidance as well. We also had a number of partners in the research. Many of them were community not-for-profit health charities who gave us insights into their different kinds of communities. And those were physical and mental health types of conditions. In terms of our funding, where we got funds to do this research, the funds came primarily from two of Canada's federal granting agencies, the Social Sciences and Humanities Research Council of Canada, SSHRC, and the Canadian Institutes of Health Research, CIHR. We did get some initial grant up front for Canada Life when we were doing some of our early JDAP work. We won some prize money from Mars, and we got some KTE funds from Employment and Social Development Canada, and I'll refer to some of this later on. So that's a little bit about the background. What I'd like to do now is just set the stage a bit and talk about disability in Canada. And the first thing I wanted to do is just kind of tell you what I mean by that term, because it's a term that I think a lot of people have preconceptions about. We followed the World Health Organization definition. And the main points here to keep in mind is that by virtue of living with a chronic condition, it doesn't guarantee a disability or a developmental condition or some other kind of condition that may create limitations or contribute to limitations. And what we mean by a disability is that a person may experience a limitation in performing activities. And that limitation may arise partly from a health condition, but also from personal and environmental factors, including negative attitudes, policies and practices, inaccessible physical environments, limited social support, with the idea being that a person may have no or little disability in some environments. They may have more in others, depending on what's going on in those environments. And why that's important to keep in mind is it means that changes that we make, for example, to workplaces or work practices, can really help to minimize or even ameliorate a disability. In Canada, we have, Statistics Canada tells us, about 8 million Canadians who are reporting living with a disability. Unlike what many of us think of in terms of a continuous or permanent disability, somebody with a hearing or visual limitation or a mobility limitation, in fact, over 60% of what we hear from people living with disabilities is that their experiences are episodic or dynamic. They change. So people will have periods of time, often a month or more, sometimes years, where they have few, if any, limitations, or it may change depending on the environment. Sometimes people report having a progressive condition. It's getting worse over time. Other times there's a lot of fluctuation. And then for about a quarter of Canadians, it's this kind of recurrent, where there can be really quite long periods of time with nothing in the way of limitations. Another thing that's important to remember, in addition to this kind of changing nature, is that a lot of disabilities are unpredictable and invisible. In other words, a person can be doing everything they should be doing to manage their health, their treatment, and they may still have a flare or an episode. And also, people may not be aware that someone's living with a condition. They may notice something's different at times, but they won't necessarily know that the person has a disability. And I put down on the bottom of this slide a number of examples of mental health and physical conditions. And there are others as well that often have this kind of episodic nature to them. So what that means is for a workplace is that this change, this unpredictability and invisibility associated with many disabilities, is that there can be challenges in a workplace. And again, many of you are familiar with this, but the challenges often arise around two particular areas. One is communicating about needs for support. Should I disclose to whom? What should I say? How can I have my privacy protected? How do workplaces protect privacy and communicate about disability? And providing support or accommodations can be a challenge, particularly if things are changing. And so these are the big issues that we wanted to tackle. And they are very big and complex. If I had to kind of put them in a very simple schematic, it might be, a worker is saying, that they're having a problem or a support need. The two things we hear from them are, should I say something and what can I do? And we hear that from workplaces as well. What can we do? What should people say? And so that's where, again, we focused on building a couple of different tools. One is a communication decision support tool called Decide. The other is the Job Demands and Accommodation Planning Tool, or JDAPT. I put links up. You'll see them a lot. The tools are free. You can check them out. You don't have to take notes. The slides will be made available to you if you are interested in them, and I hope you will be. So before I get into some of the specifics of the tools, I just want to talk a little bit about this disclosure piece. Why is it so difficult? And how are workers making decisions? So we, have a better insight into that. We know from Canadian surveys, and it is important to look at Canada as separate from other countries because we do have different privacy laws and accommodation laws. But we hear anywhere from about a quarter to nearly half of people who live with physical or mental health conditions will say they have not shared any information about their limitations at work with their supervisor or manager. So it is not uncommon for people to not say anything about their health, even though sometimes workplaces feel that this is something they're hearing about all the time, and they are. There are many people who don't say anything. People are less likely to share if they have a mental health condition, which is not surprising. There's still a fair bit of stigma associated with a lot of these conditions. But I think it's important to understand what the reasons are. We did a study a while back. There were approximately 437 people who had not shared. That was about half of the sample that we looked at. And they had a lot of different reasons for not sharing, and often more than one reason. Very frequently, it was because they were managing at work. They didn't feel they needed to share. Their health wasn't affecting their ability to do their job. And so those are common reasons why people aren't sharing. Sometimes people feel others don't have the right to know. They don't feel anything can be done, which is often a problem because they don't get help then in advance. But there may also be concerns about losing a promotion or career opportunity, not feeling secure, having bad experiences when you have shared. So an awful lot is going around these decisions. We also know that there's no single correct communication decision. So the hardest question I get asked, should I say something? I don't know. And there are, there are good and bad that we hear from research in sharing, but we can help people make a decision. So in terms of positive outcomes, we will sometimes hear people who have disclosed will say that they got greater support and understanding. And so it was a good thing. They felt that they had shared some information. Sometimes in terms of the negative, they will also, though, say that, well, but now I feel everyone's watching. I have to prove myself all the time. Or sometimes people do experience stigma or gossip or loss of a reputation as a good worker. So for many people, they'll decide, well, I don't want to say anything right now. That may also work out well for them. They may have less stress, less concern about how others view them. But of course, at the end of the day, you may not get the support you need, which can be a significantly negative outcome. And there can be misperceptions about the reasons for job difficulties. And what I mean here is, and we hear this a lot with people who have chronic pain or chronic fatigue, people who may have mental health conditions, is that sometimes there are some signs that something's not right and it's leaking. Others are noticing, and you may not even be aware of it. And in the absence of having information about why a person may be not doing as well, people will fill in the blanks. They'll say, this is not a good worker. This is someone who lacks skills. They're not motivated. They don't get along well with others. So there can be negative consequences to not sharing when people notice signs of a problem but don't understand what's really happening. And other reasons why the decisions are so difficult include just issues around the whole mechanics, I'm labeling this, of disclosure. So a person has to consider, am I going to say something? Who am I going to talk to? When's a good time to share? What do I say? How much? So people are trying to grapple with all these kinds of pieces of making a decision. And it's usually not a one-time decision when it's a chronic or an episodic condition. It involves multiple decisions. And that's because a person's health may change, their job duties may change. There are deadlines that need to be met, may get a new supervisor or new colleagues. So we hear from people that this is an ongoing decision and it's a tough one to make. As I mentioned already, one of the big challenges is that you don't know what the outcome will be in advance. So people have a lot of concerns and worries about what this might mean for them in terms of their reputation and career. And as I mentioned, we do find positive and negative outcomes associated with disclosure. And then there's a piece, and this is one of the pieces we wanted to focus on in some of the work that we did in developing a tool. And that is, what really should you think about when you're making your decision? What types of things should you take into account? We wanted to help people so they didn't have to always reinvent the wheel, and wanted to learn whether people are prioritizing in some types of information over other types of information. So just to give you a little bit about that before I tell you about the tool. What we've heard from people is that there are a number of, and I'll call them kind of buckets of information that people take into account. So a person making a decision is going to think about health impacts, what's happening right now at their job, are there changes, are there safety concerns with some new meds that they're taking. People will also have goals. Maybe I want information or access to support, but maybe I just want to protect my job and my finances and my reputation. People will have preferences. Some people feel happy to share. They feel they have an obligation to share. Others really value their privacy and they want to control information. And of course, people may have positive or negative past experiences. And then, of course, people will look at their workplace. What do they actually have available? Do they know? Do they have personal days, paid sick days, those kinds of things? And how do they feel about their colleagues in terms of how supportive or not do they feel the culture is? And the challenges with all these buckets of information is that sometimes it's kind of encouraging you to say something, and sometimes it's discouraging you at exactly the same time. So, for example, in a study that we did with nearly 600 workers, we were living with a physical or a mental health condition, sometimes both. Nearly half of them, 49%, had considerable impacts and needs for support in their jobs. Many of them saw sharing as helpful if for meeting accommodation and information needs. And in our case, there were actually quite a few people in this study, 78%, who had some supports available, quite a few supports available, often in their workplace through HR or disability managers or a union or just, some good people that they were working with. But at the same time, we had the top goals that people mentioned were actually not getting accommodations. They were protecting their job, their financial security. So while those other things might have encouraged people sharing, these kinds of goals were really making people reluctant to share. We had about 32% of people, nearly a third, said, yeah, I'm willing to share. I think it is important. But we had 37% of people who said, no, I'm really personally very reluctant to give people any information about what I need. And 20% were really sitting on the fence. They could see the positive and the negative. We also heard from people that about 58% said, yeah, the culture in my workplace is pretty good. But 16% were, again, I see good, but I'm also really quite worried about this. And 1 in 5, 20%, said, no, I really don't believe the culture in my workplace is a good one for sharing information. I think this could come back to haunt me, and didn't want to share anything. So you can see, again, gets really complicated very quickly. If your head is spinning, I'm sorry, so is mine. It's tough to make these decisions. And so that's why we created a tool. DECIDE stands for Decision Support for Communicating about Disabilities that are episodic, but it can be used for other kinds of conditions as well. We didn't want to tell people what to do, but we wanted to really help people make a decision that was better for them. And so the tool has, I would say, a kind of a prevention and support framework. Really want to help people to be more proactive, less crisis focused. We also wanted to make a tool that was personalized and interactive, and obviously based on evidence and accessible. There's a lot of resources out there. You can find lists and lists of think about this, think about that, pros, cons, and it's not really necessarily personalized for you. They may also be very focused on specific conditions. So we wanted something that would be relevant to a lot of different kinds of conditions and a lot of different jobs and personal preferences. One of the other problems with a lot of resources, you don't get any feedback. It just tells you to think about a lot of scary things, and then you're on your own. So we wanted to be able to help people. And our goal here, of course, is to improve the decision process while at the same time protecting privacy. So what you would do, and then again, the link is there. The tools are free. We do not collect any personal information. If you went into the tool, you would be asked to select whether you want the English or French version. The tools are all available in both languages. You would read through the introduction and how the tool helps. And then you go through the five kind of buckets I mentioned earlier. What are your needs? What are your goals? What are your personal preferences? What's it like in your workplace in terms of the availability of support? And how do you feel about your workplace? The questions are very easy to answer. Most of them are yes, no, I'm not sure, or there's a kind of a statement and you say whether you agree or disagree with that. So you fill out each of these, but after each one, you are put by the computer, the programming that we've set up, we put you into a category that kind of summarizes where you are. So if you had finished answering the questions about how you feel about your work culture, the programming of the tool will put you in based on your answers in a group where you feel largely that your culture is supportive or it isn't supportive, or you're really not sure, you're seeing it in both ways, or you just don't care. So you get this kind of feedback, and you are given some information about here's what we're hearing from you, what your situation is. And now here's what we'd like you to think about. And so you get some feedback to kind of distill the information and have you think about sort of some next steps. Are there some maybe negative consequences to where I am? Are there some things I need to think more about if I'm going to kind of feel this way? When you're done all 5 sections, you get the summaries for all of them, and you can save that in a PDF. We don't save any of the information. And from there, you're moved into a couple of different directions, some next steps, and onto the other tool that we've developed, the Job Demands and Accommodation Planning tool. So the next steps are just getting back to some of those mechanics that I talked about earlier. You know, you said, or based on all of this, it seems like you're not interested in saying anything quite yet. What can you do to help yourself? Maybe you are interested, you're not sure how you want to approach a meeting. Well, if you're thinking of a face-to-face, here are some advantages, here's some disadvantages. So you get a lot of information to kind of move you forward. And then, of course, we move people on to some of the accommodation planning. So before I tell you about that tool, the JDAPT, I just want to give you here again a little bit of background around accommodation planning, what we hear from workplaces and what we hear from workers. So we've done work talking to a lot of folks like you, like many of you, HR, union representatives, disability managers, business owners, supervisors, managers, about the support process in different organizations. And a lot of themes come up. I'm just going to quickly touch on 3 of them. One of the themes is around workplace culture and support. And very often we hear, especially if it's a larger organization, and it's often quite a medical model in the sense that people will want a condition verified, they'll want health professional input for it. But we also hear from a lot of workplaces this isn't working nearly as well as they would like. There can be delays. A lot of delays if people don't have a healthcare professional, or it can kind of undermine trust. People may have a hard time getting notes. The notes may not be particularly helpful. Of course, not everybody gets access to the notes, but you know, it makes the process bigger and not necessarily always better, although it does often verify that there is a health condition. So often we're hearing from workplaces that they need to implement more of what we might call a social model of disability, where we take a look at how accessible our environments are. We look at our policies and practices and what the barriers might be there. We also heard a lot from various workplaces about the misgivings they have of everybody else involved. So there are often a number of people, as you will know, involved in the support process, and most of them took a hit from others in the sense that, for example, supervisors, sometimes they're wonderful, but often they don't have much training. It makes for a really haphazard approach sometimes, and they aren't necessarily the best people to be implementing a lot of this. And yet HR is sometimes perceived as being there for the organization, not the worker. Not everyone belongs to a union. Unions are sometimes helpful, but sometimes they're seen as being there for the many and not the individual. This is, some sort of special changes that are needed, and that's sometimes not welcome. And health professionals, well, they're clever people, but they often don't know what's going on in the workplace. So we heard a lot about this, and that can make for a lot of challenges in implementing support. And then we also heard that, there's often this crisis, and this happens with episodic conditions that change a lot. People will, if I just go home and I rest, I'll be better next week. I don't want to say anything. So they put off, and then there's a crisis. Sometimes that crisis comes about with formal communication being triggered by absences, and people find themselves in an attendance management program. That means sometimes planning now becomes very reactive, not proactive, and disability can be recast as a performance problem that needs disciplinary actions and not as a support process. So lots of problems that we hear from organizations and also from workers. I've mentioned the worker problems already a bit. One is around the disclosure piece. What do I say? And this is very scary. A second big challenge is people being unaware of what they even have available to them in workplaces. Sometimes people go looking online. There are some good resources out there. They're often very disease focused. So if you were living with lupus or you had ADHD, it wouldn't necessarily occur to you to go looking on a cancer site or a mental health site, although there are some fabulous resources and information on some of those sites that would apply to many people. And then also you get people who are concerned there's really nothing I can do. And so they just try to muddle through until this becomes a crisis. And then if you are living with a health condition, of course, starting the process can feel overwhelming. How do I even begin these issues and these conversations? I don't know how to talk about this. And it's hard for me because I'm going through a lot as well. I'm just trying to keep my head above water. So for us, in terms of the bottom lines in setting up a need here, we know that workers are looking for guidance on whether to communicate, how to get help if they don't want to share information, and what to share. Workplace professionals really need a transparent, consistent, and comprehensive approach to assessing what they know are going to be quite individualized needs and something that fits with their processes and doesn't undermine them. And of course, everybody would like some practical support and accommodation ideas. So that's why we've been focusing. It took several years to create this tool with all the testing on a job demands and accommodation planning tool. The goals here, very similar to the Decide tool, trying to help people be more proactive, less crisis focused, integrate with what's there, really focus on practical supports and ideas to meet job demands, be widely relevant across a lot of different jobs and disability types. We can't do everything for everybody, have every idea. So something that will help promote discussion and brainstorming so we can improve outcomes, and something that is really tailored to a worker, to their situation. So what the tool does is it focuses on work demands that are challenging at times or regularly. It doesn't focus on what the diagnosis is or the symptoms. It walks a user through a series of questions about their job tasks and working conditions. And then the person gets some personalized support ideas that are relevant to those job demands. So you don't have to be thinking of what might work for you. You just have to answer questions about the job. There's a tool a worker can use on their own. They can discuss it with other, and then there's a couple of organizational versions. I'll just note that back in 2022, Mars, which is a venture capital group, and CIBC hosted an inclusive design challenge focused on support at work for people with disabilities. And the prototype of the JDAPT was the grand prize winner back then, which was tremendous. We have been working on it to enhance it ever since. So I'm going to walk you through a little bit of the tool. There are 24 job demands. They're organized into 4 domains. So a person would answer some questions about the physical demands of their job, the cognitive or thinking demands, working with others, and working conditions. And as I mentioned, there's a version for workers they can fill out on their own. There's also an organizational version. It can be completed by a supervisor, HR, a union rep, a disability manager, but someone who's familiar with the worker and their job and their needs. And they can do it on their own or they can do it with the worker. And then there's a third version that I'll mention, but I won't talk as much about today. We heard from some workplaces that they didn't always have a worker in mind, but they were really trying to look at their workplace to how they could make it more inclusive and accessible. So there is a version where you can focus on a job, not a person, and get some ideas for ways to be more supportive in that particular job. But for those other versions, the worker and the organizational version with the worker in mind, for each of those 24 job demands, the first question is this an important aspect of the job? If you say no, you move on to the next question. If you say yes, then the worker is asked, is this difficult due to your health, this particular job demand, and does it change over time? Is it constant? In the organizational version, are you seeing this worker having difficulty with this job demand? You don't attribute it necessarily to their health, but are they having difficulty with it? And again, is it constant or does it change? After completing all of those 24 items, you get a personalized summary, and I'll show you that in a minute. And then for any item that is challenging, it's linked to some support strategies. Here again, a person can download a PDF. We don't ask for personal information, where you work, who you are, or about you, and we don't save any information. So it is very private. So these are just some screenshots. This is the landing page. And if you came here, you would choose which version of the tool you want and whether you want the English or the French version. You then would move on to the introductory page. How does it work? How does it help what it isn't? It's not legal advice. It's not clinical advice. And then you go to the instructions. And I mentioned them already. Is this important? Are you having difficulties? How is your ability to do this? And does it change? We've heard from workers how helpful actually even this piece is when they go through. If you have ADHD or if you have, again, chronic pain and fatigue, it can be exhausting to even think about this. It can be hard to know where to start. So the simple pattern here works very nicely for people. And this is just a couple of screenshots of the physical demands. And so, you might be asked, does your job involve doing activities that require physical endurance or stamina? If you're not sure what that means, you can open up a whole lot of examples of what different jobs look like that have this. And you can say, well, this is important or not. You can save a draft, come back to it later if you get called away, but it gets wiped after 72 hours. And you can also add information if you're not finding it's not quite capturing a job demand. So you'd go through all the 4 sections, and these are actually 2 screenshots. I know you can't see all of this. That's okay. If you look in the bottom left, you see 16 of 24. So this fictitious user has answered the 24 questions and said that 16 of these job demands are actually relevant to their job. And then on the right, you see some bubbles. One of them has 8 of 16. So again, this fictitious person has said that of those 16 job demands, 8 of them are challenging for me at least some of the time, and 7 of them change. They're not always a problem. So that's kind of your summary, and it breaks down each of the sections for you in a bit more detail. This person now will get accommodation support ideas for 8 of the 16 items, because those are the areas they're having difficulties. So although the website doesn't look like this, what you're essentially going to get is, if you said that physical endurance or stamina on the far left there was challenging for you, you get some ideas of things you can try on your own, things you can try at work. You may not need permission for them, and then the more formal accommodations. So things you can do with and without others necessarily knowing about your needs. For every single one, they break down and give you more concrete ideas. So that, again, if it's not perfect for your situation, hopefully you can use this to kind of brainstorm solutions. If you change to a different activity that the job demands, so concentrating for long periods, again, you get ideas, things you can do on your own, adjustments at work, formal accommodations. But of course, now they're different because they're very depending on this activity, and you get the examples. You can see there might be a lot here. If you're filling out an employer version, you may know this is not going to work for us, these. So you can click on those that are relevant and create a personalized list of things that are really those that you could talk about in your workplace. At the end, you can again save parts of it or all of it as a PDF for yourself. So that's the JDAPT. Just a few more comments about it. From our perspective, the when to use this in an organization is really quite early in the disability support process, and we hear that from others that that's very helpful. It puts everyone on this kind of level playing field right up front. Now we know where to go. And if you do need additional assessments or information, at least now we're working kind of understanding the problem in a better way. We also would recommend that people use it on a regular basis to assess changes and needs and support and to kind of reevaluate where you are. The why use it, it really focuses the conversation on job demands and not on worker personal characteristics. So both workers, HR, disability managers, we hear this is really helpful. It feels much less judgmental. It often identifies areas of work that are sometimes omitted in other assessments, like the interpersonal aspects of work or job conditions. And of course, most of all, it's providing some support and accommodation ideas. So I'm just going to finish very quickly here with a little bit about some of the evaluations, what we've heard from others in terms of the tools, and particularly the JDAPT, because it's been out for a couple of years. We have done a number of assessments to, did we even need to do this? Is there something else out there? We've done evaluation early on as well as some outcome evaluation. We'd like to do some implementation evaluation. But in terms of some of that early work that we did, we spoke with others about the tool's comprehensiveness, understandability, relevance, feasibility. And this was very labor intensive. We had 46 workers, 23 organizational representatives fulfilling different roles. We sat down with them and we went through every single question in detail. Did it make sense? Do we need more examples? Do we need other questions? And so the tool was very well received. We did add 3 new items to make it more comprehensive. But these are just a few quotes that we heard from people. It seemed like you covered every piece, whether it was the physical piece, tedious work that's happening over and over again, or working long hours, traveling. So you've covered everything. That was a baker living with ADHD and a skin condition. There were basically all of them that I go through in my job. It's basically everything I do at work. That was a truck driver with Crohn's disease. And someone said, I go in and just say, I'm dealing with a mental illness. And my boss says, what do you need? And I say, I don't know. I think the JDAP might be better to help me understand actually these 3 aspects of the job, what are difficult for me. So let's think about what we do with those. And that was a government worker living with depression and PTSD. These are very representative of the kinds of things we heard. I selected them, as you can imagine, because they were very different types of jobs and very different conditions. And so it was really nice to see that the tool seemed to be able to accommodate quite a few different types of jobs. We've also done some outcome evaluation, and in this case, we followed people over 9 months, and we spoke to them at 3 different occasions. There were 188 workers here. They lived with physical or mental health conditions. And what we did is we found out a lot about their work and their challenges, their difficulties, using a lot of different measures that exist before they'd ever seen the JDAPT. Then they filled it out. We went back to them 3 months later, said, are you using this? Why not? Was it helpful? And then 6 months after that, so 9 months from the beginning, same thing. Have you used any of this? Why not? Why? How do you feel about it? So the comments were very positive across different types of disability, quite different conditions, across gender, age, different job sectors, which again is helpful because it means that the tool's useful to a lot of different groups. People were using the JDAPT over the 9 months, loved the strategies they could do on their own, but also we had people who were saying they were developing formal accommodation plans based on them. And we saw statistically significant changes in people's confidence, so their self-efficacy and problem solving, meeting their job demands and dealing with stress, fewer work productivity problems, less absenteeism after using the tool. And these changes were highly significant statistically, but they were also something called effect sizes. So you can have a change that's not likely chance, but it's a small change. Or there can be a bigger, more meaningful change. And most of the changes were in the moderate to large. So they would be the kinds of changes you would notice in a person's work. And again, just to finish with some quotes, it was empowering to see how much one can do on one's own, especially when I'm hesitant about being supported by HR. I used both the full and my personalized list of strategies and accommodations when I was informed that I would need to return to working in the office some days. The suggestions were very helpful. And I used the list of strategies and accommodation plans, plus the language of the job demand summary to help me request a workplace accommodations plan. These tools were critical in helping me explain how my disability impacts my work and allowed me to think about possible solutions. Without the JDAPT, I wouldn't have had the confidence to go through this intimidating process and advocate for myself in such an effective way. And the intimidating in brackets is their words. These were written comments. So I really would encourage you, if you think it's relevant to you in your workplace, to try the tools. Again, we don't ask for personal information. The tools are free. You can download responses. We don't save anything. As of March of this year, the JDAPT was available for 2 years, and the Decide tool only 6 months, but we've had over 31,000 visitors to the website from a really wide variety of countries. And I just want to completely stop, but let you know, I mentioned earlier that we were doing some research. We did research with workplaces. We've talked to supervisors, business owners, HR, all those different folks. We did all that research just before COVID. And so now we want to do it again. We want to really learn about whether work is changing, support is changing. Are you talking to more people, different types of people? We'd love to hear from supervisors, managers, HR, union reps, occupational health and safety representatives. These are confidential interviews. They take about an hour. If you are interested, you can find out more information at the email there, or you can email me. We'd love to get some of your perspectives on support provision. And so I'll just stop there and thank you. And if there are questions, I'm happy to answer them. And maybe I will stop sharing. There we go.
Okay, thank you for that. That's a lot of information. I like how there are certain webinars we have where they're really research based, which validates the information. One of
Thank you.
the stats was, I had to write it down, the only 58% of people reported a positive culture of accepting the disabilities in the workplace or communicating that in the workplace. And that's, I'm not sure if that's lower or higher than what you've seen over the years. I would hope it's trending upwards, and hopefully it goes way higher than that. But what was your experience on that one?
And it's a good question. We don't have a good sense. I mean, often the studies are small, and I would say people who are in the studies often have a problem with the culture. And so, you may not be getting a full perspective. We were actually thinking this was not bad at all. We are seeing, I think, improvements in how people feel about the culture. And this was the culture in terms of providing support, people
Okay.
being aware and feeling it was more supportive. But I know a lot of organizations would think, yes, I can do better. And I can tell you, when people are making a decision, what kind of information do they prioritize? Culture is one of the really big pieces. And so often people will sacrifice needs if they don't feel the culture is supportive, they're not going to say something.
Okay, interesting. So there's a couple good questions here. I guess one of the first ones was, is there a certificate of completion at the end of this webinar. Um, from my side, we wouldn't be issuing one. If anyone has a designation, for example, that you need proof of the ongoing training requirements, I'm more than happy to respond in an email to prove that you attended the webinar. Some people need a certain number of hours, some people need something else, but from your side, Monique, anything you could help with that.
At the Institute, when we do webinars, we also will provide a certificate of, that someone did attend, but no, there isn't anything from us for this webinar.
Okay, thank you. Um, uh, one of the questions was, how do we ensure these support systems are maintained instead of forgotten?
It's a good question. I think I think many organizations have policies and practices. I think documenting them, reviewing them, like building it into what you do, where you're going to review this every 6 months or a year. What are we seeing here? What are we doing? I think that's really important, that it needs to be built in as part of our work. Again, that's that more proactive, not waiting for the disaster or the crisis, but knowing, because you know how many people aren't saying something, knowing that across the trajectory of a worker's life, there are going to be things that come up where people will likely need support. Um, I also think be careful using the word disability. A lot of people don't consider themselves disabled. I explained what it means. A lot of people are really, I didn't know that. That is me. But just saying we're here to provide support for a variety of different issues and getting people to think through some of these issues, newsletters, all kinds of things to keep it top of mind.
Okay. Another good one that this might kind of transition what your answer was as an HR person, is it okay to share resources with employees without them asking first? And I'm not sure if the question was resources broadly or directly at one person, so I'll let you maybe answer both of those.
Um, Yeah, so thank you for that second part, because that is interesting. I would say sharing widely through newsletters and other kinds of things, because again, there may be lots of people you don't know that would find this. It is very helpful. We do hear sometimes from HR and others that there are sometimes workers who aren't coming forward and they can see that there are challenges. And that it can be very messy and complex. This sometimes happens, for example, with mental health. And if you approach a worker, they might say, "Why are you out to get me?" If there's some paranoia or other things where they're not aware, it can become very, very messy. So I don't have a right answer,
Okay.
but I think if you were working with someone and you felt comfortable, it could be, gee, Hunter, I notice you're seeming to struggle. And I just want to let you know there are some resources, and these are some we found that people, have found helpful. And you don't have to share it with me. You can do this on your own, and I won't know. And that's that big privacy piece. And that's why it's not linked to people's work sites. It's a separate website. I'll never know if you filled it out or not.
Okay. Another good one here, which is is maybe dependent on the situation, but the example someone gave here is they have hired a deaf employee. So how would they go about not introducing, but maybe allowing other employees to know about this part? So, for example, if you're going into a meeting and there must be potentially need to be like an ASL interpreter, how would you go about? I'm not sure if the word is advising other employees, but yeah.
Yeah, I think, and that's it's a good and it's a potentially complex question. I
Mhm.
think the first step is to speak with the worker about
Right.
how comfortable they are with others knowing, and really try to work through it, in terms of in this situation, it may become quite apparent what's happening because there is an ASL interpreter there, and that person's going to be working quite closely with the person who needs their help, and that person's going to be watching them. So it may not be a secret very long. Sometimes, though, if the person's really uncomfortable, sometimes meetings would be online, where not necessarily everybody then needs to know. So there are ways around, but the first thing would be to really trying to work through with the worker what their preference is and why they might be reluctant to have others know. And so can we overcome that?
Right. Um, so if someone asks for accommodation, what would generally be the first thing that the employer could do? And the follow-up part is that is should you just first send them to the JDAP tool or another tool that you have?
Um, I I actually would send them to the JDAPT, and say, one of the first things that really helps here, because people may not be aware of the extent to which their health is having a problem. You may have some very good idea about something, but you may not have thought it completely through. And that's what we saw a lot when we gave it to people and asked them,
Mhm.
and then we asked them to fill out the tool. Often there were other things that came up.
Right.
And then also say, and the tool will help you to think through whether or not some of the supports you think might be helpful. And that we can use to go through together to talk about whether we need some bigger changes, whether you can manage and make sure we've covered everything. So that's how I would present it as the reason for this. If there's an immediate need, like I need to work at home now kind of thing, you can deal with that, but this, I think, is a really important first step.
That's a good one. Something that when we're building out our courses for SkillsBridge is some people don't know what they don't know, or they
Mhm.
don't know how to ask something. So it's good if, for example, depending on the situation, like you said, do you go to the tool first? So then you're kind of prepared when you go to the employer or supervisor, and you have a better understanding of what you're allowed to ask or what are some options, because it could be on both sides that both parties don't generally know everything.
Right. And a lot of the time people, when they have a health condition, they don't want to share their symptoms and like what they're living with. They want to, because they want that to be private. So you don't have to say I'm having trouble. Like I'd like to move into a certain part where there's more privacy, whether that's mental health or need to be close to a bathroom or the noise. You don't have to share that. You can focus on what the challenge is, and that can be helpful in moving the conversations in the right directions.
I know we got about a minute left, and if you're okay to maybe go another minute or two past, but this one's more about kind of the hiring and onboarding process. I
Mhm.
believe it's more the hiring process, but are you allowed to ask about disabilities during the hiring process? If no, why? If yes, how and when?
So that's complicated, and I'm not a lawyer, but I
Yep.
will say
Okay.
that you are allowed to put in your ads that if someone needs any special support or accommodations to participate in the interview, they can contact you and you will do your best to arrange that.
Yep.
You are allowed, again, to ask, but people prefer often, the suggestion is you don't do it until later because you don't want to be looking like you're discriminatory. The first thing I asked you when I first met you is this.
Mhm.
But as you are working through and someone is looking like maybe they are the person you want to hire, perhaps saying, would there be some accommodations or supports that you need? You're not allowed to say what is the condition, and things like that.
Okay, thank you. I'm just pasting in a link to one of the surveys for us. Um,
And while
uh,
you're doing that, Hunter, I will just say, please feel free to reach out to me at my email address. I'm happy to answer additional questions.
okay, well, thank you everyone for your time today. We'll be sending out a recording and also a link to SkillsBridge and some more resources for you. So thank you, everyone.
Thank you, everybody. I really mean it. Please reach out. Try it out. Take care.